Hi, I'm Dave Taft,
And I'm John Tansey.
and together we're
Windsor TNT.
Today we're honored to have Jill Lord, the Director of Community Health, here as our guest, and hopefully we can inform the public on some of the things she's got going on and how to better engage the community in some of what's happening. So,
And I'll mention that's Director of Community Health at Mount Ascutney Hospital and Health Center.
Right.
So you know the location, although we think it's Director of Community Health for Windsor, and you really are because your presence around town. But so we feel you're a community asset,
Thank you.
and so is the hospital.
so thanks
Thank
for
you.
coming in and taking the time out of your schedule to talk to us.
It's a pleasure.
Why don't you start out and tell us a little bit about yourself and what the history of what you've been doing recently.
And maybe even starting like where she grew up and how it came to Windsor, or do you want? We'll get to
Well,
that.
he doesn't care about that.
Well, yeah, we do. We'll pepper you with the more detailed
Okay.
questions in a minute.
All right. Well, I grew up in the Burlington area and moved down here when I was, I don't know, had my first child and lived in Sharon, lived in Cornish, and I've been in Cornish for about 26 years. Yeah. Worked at the hospital. I worked at the VA for about 10 years. I'm a nurse, and done a lot of different things in nursing. Worked on an oncology unit. Worked with community health. I worked with long-term care, and I was at Mount Ascutney Hospital for 24 years as their director of nursing and responsible for all the clinical services, lab and x-ray and pharmacy and so on, as well as doing community health. And last year, because there's so much of an emphasis on the need for improvement in population health and making a difference in the health and well-being of the community, I switched, and I'm just doing that now, working with the the whole continuum of care from prevention to chronic care management, and it's great. It's a wonderful community to work in.
So, what types of things do you do to let the public know what's available and what programs can they access to better take care of their health?
Well, there's actually, to start out with, I think it's important to know that we really actually need to hear from the community first. You know, what are the issues that people are dealing with? What are the struggles? We do a community health needs assessment, and at that time we look at all of the indicators of community health, and that would be the statistics, the things that you can get from like morbidity and mortality, the things like what are the outcomes of care. We look at the youth risk behavior survey. We look at other surveys that tell us about blood pressures and people's, the incidence of diseases and so on. But we also spend time talking with the community about what they see, what people's struggles are. We do focus interviews and surveys, and out of that, it's a long process of hearing from the community, looking at the data, and putting everything together, and we come up with these, last time it was 12 indicators of community health needs. And we really base our program on that. What are the biggest needs of the community? What do we need to do to make things better to promote health and wellness in the community? So there's a lot of things that we're working on based on those 12 areas of community need. Everything from chronic disease management to prevention. And I wondered if I could start out with like a little parable about the whole thing.
Sure.
So there were 3 friends that were walking on the side of the riverbank on a beautiful day like today. And they were walking down, having a nice conversation, and they, were having a great time, and then they started to hear yelling and people in trouble. And so they ran up ahead, and they saw all these people in the river, and they were yelling for help, yelling for help. And so one of the friends jumped in the river to try to swim and save some people. And he did, and he was saving people. And then the second friend said, we have to do more. We need to build a raft. If we build a raft, we can save more people. And so we built a raft, and then he went out and he got to save, more people. And then the two friends looked at each other and said, where's the other guy? And he was going up the road. He said, I'm going to find out why these people are in the river, and I'm going to stop it. And so that's kind of a story about what healthcare is about and what we're doing with community health. So the guy that jumped into the river is the guy that's in the hospital, the hospitalists, the people that are in the intensive care unit that are really working hard to make sure that right then, when they're needed, they can help people be healthy. And the person that's working on the raft are the people that are in the primary care practices, and they're seeing people every day, and they're figuring out what is wrong, and they're helping them to become healthier and to really try to prevent diseases. And the person that went down the stream to try to stop people from jumping in the river are the people that are working on prevention, that are trying to prevent the diseases and the illnesses in the first place. So I guess one of the things that I'd like to talk about, that we're trying to do is prevent disease. You don't hear a lot about that, but it's a powerful thing. And so one of the things that we're working on is this program that we're doing with the health department called 3-4-50. And so I know John knows what 3-4-50 is, so I kept Dave in the dark a little bit.
Yeah, explain it to me, to the rest of the people here, and me.
Okay, so 3 stands for the 3 behaviors, and those are tobacco use, the nutrition, and exercise that relate to the 4 diseases that are diabetes, lung disease, cancer, heart disease, and stroke that account for over 50% of the deaths in Vermont. You think about that, and it's a pretty powerful thing. Things that we actually are in control of. We can prevent diabetes. Now, I think most people, if I looked out and I saw everybody that was listening to this, and I looked at the two of you, I said, how many people know somebody that's been affected by diabetes, cancer, heart disease, or lung disease? I don't think there'd be a hand that wouldn't be raised in the room. And the thing is, we don't think about it, but it's true. We can actually prevent those things from happening. We can prevent diabetes. We can't totally prevent it, but you can prevent a lot of it, and you can prevent the complications that happen just by the way you live your life with, the food that you eat, the amount of exercise that you have, and by not smoking. And so we're really trying to send that message to folks that you can make a difference in your own health and in the health of your community. And frankly, we want Windsor to be the most healthy place in the world. It can be, and we can work on it. And so we're doing it in a way that isn't just say no, because I don't think that works that very well. Just don't smoke. Just don't eat sugar. Just don't be a couch potato. Well, no, we're doing it in a way that we want to celebrate what people are doing, because we think a lot of people are doing a lot of good things. And if you take an inventory yourself and think of what you do to make, have yourself be healthier, actually you're doing a lot of things. So what we want to do with 3-4-50 is celebrate what people are doing. And actually Windsor On Air has been a great help, because Paula has advertised information on Windsor On Air about 3-4-50 before. We've had like a postcard campaign, and asking people to send us in information about what are they doing to be healthier. And I get to receive these postcards about, I haven't been smoking for 46 years, or I haven't been smoking for 2 days, or I've started walking my dog, or I've started, sending my kids out to play instead of, texting and being on their phones. And so it's really fun. It's a positive way, and we can think we think we're making a difference with it, and we think that together we can make more of a difference. It's simple, but it's really powerful, but it's also at the same time hard because, you know, like it's every time you make a choice of what you eat, or, you know, I'm going to park my car this much farther away from the door instead of trying to get as close as I can. You know, I'm going to get up every hour and I'm going to just walk around, you know, to try to increase my exercise. People can do little things like that that can make a difference in their health. And if we all start doing them, our whole community gets healthier. You know, we hear a lot about childhood obesity, and we hear a lot about, you know, the rising incidence of diabetes. And actually you can, you know, really prevent by diet and exercise the effects of diabetes. So it's very powerful. But let's celebrate it instead of taking the negative approach. So that's what we're trying to do. One of the things that we're doing with that is like like last year we talked a lot about 3-4-50 and what it means and how you can do it and celebrate it. This year we're trying to be more active and a little bit more creative about it. So we're going to like the farmers market, and we've made this like spinning wheel so that we can show what 3-4-50 is like. So you spin the wheel, the kids spin the wheel, and it ends on hula hoop, and they do the hula hoop for about 5 minutes or however they can do it. And, you know, to show, or we say, okay, you're on a scavenger hunt now, and you got to go find a tomato. You know, so we're trying to do something that's a little bit more creative and inventive. And the other thing, and you heard it first here. Well, you didn't. I actually talked about it a little bit for a couple other places, but not a lot. So we're doing a thing in each of the towns. We're having like a contest for the favorite vegetable, the favorite exercise, and a pledge not to smoke. So we're passing around these cards, and soon we're going to do a Survey Monkey. So we'll send it out by Survey Monkey, but look all around town. You'll see these cards where you can vote for your favorite vegetable. Right now, I'll tell you that broccoli is ahead of the game in Windsor. And there's some runner-ups that might surprise you. You know, and so again, the whole thing about community health is it can be fun, it can be creative, and we want people to be healthy, well, and enjoy life. And so we're trying to think of ways that we can get the message out there that you know, people can enjoy, and we can do together as a community. So I'm going to zip it because I've been talking a long time.
So maybe we can take the pledge. So
yeah, you could.
So it's not,
I don't smoke.
it's not just for school kids; it's for the whole community.
Whole community.
So
everybody can do
anybody
something.
that wants to, if they see one of these, they can
Absolutely,
participate.
So I'm going to take the pledge. I don't smoke, but my favorite exercise, increasingly is becoming walking as I age. I like doing other things, but my body is telling me I shouldn't. And vegetable is seasonal. I think probably the fresh tomatoes right now.
What's
I don't know,
yours,
Dave?
Dave?
Well,
Come on, Dave. What's your favorite?
I like broccoli. I laugh, but I've had more broccoli salad this summer than anything.
Yeah.
And I don't smoke, and I'm exercising at work all the
Yeah,
time.
you get enough exercise,
Yeah.
that's for sure.
So-
What's the fourth? Is there a fourth
I
one?
just want to nope, that's it. High five.
Does that mean I don't have to go on the roof tomorrow?
No, you need to keep
I
going.
got
on.
it.
Keep working. Yeah.
So one of the things I wanted to ask is, I understand, and you know everything you're saying, and it's all right on and everything, but some of these things I have people right now and have known people with these health issues,
Yeah.
and unfortunately, by the time that you realize how detrimental it is,
Yeah.
you are either addicted or
Yeah.
you've become so accustomed to that it's
Yeah.
they believe impossible pretty much
Yeah.
to stop. And so do you have programs that are specifically targeting young people before they've become entrenched in their habits that now they can't control anymore? Or?
Right. So that's a really good question, Dave. And yes, it's important, like we said, you know, going to the beginning and trying to prevent things. That's really
Like
important.
the guy that's going upstream to see
Yeah.
who's keep
Yeah.
people out of the
before
river.
they jump in the
So
water,
needed,
let's
right.
do something
And
about it.
so
Yeah.
the school,
So we
the-
work with the school. The school, we talked to the health and wellness community in this committee in the school about the 3-4-50, and we're working with the school on prevention programs. We've done with the school for many years the VCAT program, which is Vermont Kids Against Tobacco.
Mhm.
And we work with the school, the students, on things like they do surveys of the stores of advertising and learning about, how tobacco advertising is influencing the decisions that they're making. And they do like scans of the different stores to see where the advertising is and what and learning about that, teaching the kids about that. There's it's almost limitless what you can do, but our group, the Mount Ascutney Prevention Partnership, has been working with the school for many years on, all sorts of different programs, Kick Butts Day, all sorts of education. The walkability and bikeability of the towns to increase exercise. I'll tell you about a group in Brownsville, Albert Bridge School. These kids got all excited about it and they were going to do something. So what they did was, the mountain's there and there's families that live on the mountain, but it's pretty hard to walk down to school, right, for the mountain because of that road right there and the traffic. So they worked with a group of adults and they created a trail. So the kids could walk down to school. They created a trail. They also worked on a crosswalk in front of the school, and they worked with the select board on that. And and so kids can be really powerful change agents. And if they're involved, and they hear the message, they make a huge difference. Because we'll listen, to kids, and they'll listen to themselves, and they'll listen to each other. And so that's a great question, and it's really important.
I think they're also learning good civic skills and kind of
Right.
empowerment strategies that hopefully they'll carry with them for the rest of their life.
That's
too.
right.
Yeah.
Yeah, that's right. They can learn early that their voice makes a difference and they can make a difference in the health of their community.
well,
Yeah.
and children need role models, and I think the perception of society has changed to the point where more people are conscious now about health, and I
Yeah.
think as recently as 15, 20 years ago, it wasn't as important, or we didn't think about it as much. And I want to say one thing. I know you're out there. I met you at select board meetings and doing community service many years ago, and I'm proud to be your friend. And and I'm all for, I'm glad that just say no isn't effective way, and that we should celebrate these successes and stuff. But I'd also make a suggestion that in your opening statement you touched on, there's not one person out there that doesn't know somebody or hasn't been touched by this in one way or another. And not only celebrate the successes, but if you could find a way so that people who were in real life affected by it could tell the story of the bad things that in
Yeah.
the end, after it was too late or whatever,
Right.
that could maybe be an impressionable thing to a young person before they, because
Yeah.
if you're young and everything's good, you
You're immortal,
might
you
not
think, yeah.
understand what the real
Yeah, or I can
consequences.
quit, or I can change this, later, and
Yeah.
then, as the years pass, the activity becomes,
Yeah,
or
it's
the
true.
habit becomes more ingrained, and
Right.
it's
Right.
tough. It's tough
Yeah.
to change. I think also some of it's too is taking a small step first. If you've been inactive, it doesn't mean you have to join a CrossFit
Right.
club or get a full year's membership at
Right.
the rec center. But although they would like probably your business, but just walk more
Right.
or park a little further away from
Right.
the store entrance, and and just
Right.
try to incrementally do things like that. Or
Right.
yeah.
Yeah. Yeah. Yeah. And I found I have to do the same thing. It's everybody's responsibility. It's like I was sitting there and I was thinking, man, you're not really a poster girl for for walking, and you got to do something about it. And so I said, hey, you better live that message, and it's getting it into your routine.
Yeah.
It's switching your head around, and starting to practice it, and you find there's more people doing it. I really think that you're right, Dave, when you said that people have changed their health consciousness. I have to say it myself. I used to, I love to feed people. What I love to do, because it came from my grandmother. I love to make pies. I love to make pies and cakes and and desserts for people. It was the way that I nurtured. It was the way that I showed care and concern. And so I had to wake up a little bit about that too, and say, well, you can make, you can experiment with a good vegetable. You can have fresh fruit. And my granddaughter loves fresh fruit. I mean, she just loves it. So, one of our messages is around fruit and vegetables. The more fruit and vegetables you eat, it's healthier. And actually, what we recommend is like 5 fruits and vegetables a day. This little girl, give her grapes, and she is a happy young woman, and strawberries, and, and we're very fortunate to have, fruit and vegetables around. So, yeah.
Well, I think also
changing.
with our busy lifestyles and people, 2-income families or people
Yeah.
struggling, that processed food made its way into
Right.
our lives because it's convenient and so forth, but it also comes maybe with an increase in sodium, sugar,
Right.
and some other things that are not good.
Chemicals,
So it's
yeah.
been nice to see more of a shift recently to people, local foods, the whole local foods thing,
Right.
the farmers market,
Yeah.
and just eating healthier and less processed. And I think people, it's still a long ways to go, but are catching on
Yeah.
to that, and there are multiple benefits.
It's true.
So, what about the, strawberries and grapes? And I mean, some of this stuff is very good, but it's not always cheap. And my dad, sorry, but he says, when I was a kid, the farmers market's where you went and bought stuff that was cheap. That nowadays, he says, you go down there and he can't afford to buy the stuff there. So
that is true, but I'd like to talk a little bit about what we're doing with the Vermont Food Bank. The second Tuesday of every month, we work to the Vermont Food Bank, and they have this program, and they bring fresh fruits and vegetables to the hospital, and anybody can come up and get fresh fruits and vegetables. And we had tomatoes and radishes. We had some yogurt. Last time we had kale. It's an awesome program to promote health in a very practical way. I mean, that's one time a month, but I'd like to get the word about it, out about it. I'd like to get the word out that that's available to folks, and we want to see you there. Come the second Tuesday of the month from 10 to 11 to the hospital, and we'll give you a bag, and you can get some fresh fruits and vegetables, and it'll help a little.
Yep.
And the other thing that we've done, working with the food shelf and working with the school, is the school lunch program. I mean, it's it doesn't help. It doesn't answer the whole problem. But honestly, I've never found a silver bullet for anything that I've done. It's always you do what you can, do a little bit what you can, do a little bit what you can. And this summer, we were able to start the summer food program for meals that are open to anybody, regardless of income, under 18 years of age. And we set up foods sites at the rec, at Union Square, and at the Resource Center, and we served 1,070 meals this summer. That's working with the Vermont Food Bank and the USDA. Actually, I lied, that's Hunger Free Vermont that we worked with, a different program. So Hunger Free Vermont. But you know, it is true, Dave. Sometimes it's easier, and people think I can't do anything, processed foods, you know. But there are these things that we can do and we should do, and we're trying to do that.
So, you know, like I said, I've been talking to you about this for years. So how do we, if you know, you want to be healthy and you want, you know, how do we take away the stigma, or how do we make it so that you're not embarrassed, or how do we make it so everybody is welcome without any fallback?
Well, part of it is the way we treat each other. You know that.
Mm-hmm.
I mean, we treat each other welcome and kindly, and we have to practice that. The other part is like this food program, this summer food program is universal meals. It's not for people, but you don't have to show any card. You don't have to show anything about your income. You just come, and it's a opportunity for the community together, kind of have some fun and friendships when school is out, and to share some food. I'll tell you, at the Resource Center, they did a great job. Cherie and Steve helped the students make placemats for themselves. You know, they played some games. They made it fun, and that's the whole idea. And the other thing about that, which I'm really proud about for Windsor, is so many people of the community pitched in. You know, we had a meeting, and Old South Church, Trinity Church, St. Francis Church, the Rotary, and the hospital each said, because we had to deliver meals from the school to all these different sites every day, and we had to have volunteers every day. So everybody took a day, each group took a day, and they got volunteers, and God bless them, so many people came and really actually, you know, gave up their time, their lunch hour, to deliver the meals. And I can't tell you how many, as many volunteers as there were days from June 11th, I think it was June 11th to August 11th. So, you know, so it was a real community, everybody jumping in, and, you know, together working in a universal way for the whole health of the community, not singling out a group, you know. So I think that is important to think about stigma and care about each other, and that's one example of how we could do that, how we did that.
Well, I think another example is, and I suspect you've probably had some involvement with this, is, you know, the habit of walking is the safe routes to school, and the days that the kids get dropped off at the parking lot,
Right.
at the grocery store, and then they all walk together as a group. And it's not only is it a healthy thing, but it's a, you know, it's a nice social
It's wonderful.
time. They can chat on the way. They're enjoying this, you know, the walk through our, you know, beautiful downtown area up
Right.
to the State Street into the school. And
Right.
I think that's just another example.
It's a great example. The walking school bus.
Yeah, walking
Yeah.
school bus.
Yeah.
And it's so cute to watch, too.
I know, it's great. It's great. Yeah.
Well, I've been, you know, born in Windsor and been here all the time. And the one thing I love the most about it is the nature and the environment, you know, and as you're looking for a reason to go out and exercise, you know, we're very fortunate, Lake Runnymede and
Right.
Paradise Park and
Right.
Mount Ascutney and along, you know, we've got so many
beautiful.
beautiful places that it's not just exercise, but it really is really fun and exciting to see what's out there too.
That's right. Yeah. Yeah. It's true.
So if the average person wanted to help or get involved, they contact you?
They
or
certainly can. We've got lots of opportunities to make a difference for the health and well-being of the community. I don't know if we have some time. There's another thing that we're doing right now that I could talk about,
sure.
that there's lots of opportunities to get involved. And that's called the Promise Community work. Windsor, we put in an application and we were designated as a Promise Community. We show promise to make a difference. And this is all about kindergarten readiness. The whole emphasis of this is us working together with families to create an environment where our kids are ready for school. And that has a lot involved with it. But what we as a group talked about is creating, our vision is, that all children would and all families would be socially and emotionally ready for school when it was their time. And how could we make a difference about that? So we made this proposal, and we're in the process. We're going to actually present it at a meeting tomorrow, where there's 3 things that we're proposing to do in the community. The first thing is to support our child care providers, because we've got great people working with our children in the preschool programs, maybe at home in a child care program that they're doing, in daycare programs, and there's this called the Strengthening Families Framework that you can provide to these teachers. They're faced with, families come to them with problems all the time. What am I going to do? What am I going to do about this? What am I going to do about that? And it's hard to have all the answers. So this is a framework around family wellness. That's the first program, is to provide this Strengthening Families program for the daycare providers, so that they'll have more of a framework to help families when they come to them with questions and concerns, and also an opportunity to work together and support each other. It's not easy work working with kids. It's great work, it's inspiring work, and it's helpful to have support in it and not be isolated. So that's the first thing. The second part of the program that we're doing, again, we're trying to make it fun, but how our society, you look around, you do a scan of the environment, and you see people texting all the time, on their phone, and instead of talking with each other, they're using electronic devices. So ours is sort of a campaign, and it's called Play Aloud and Read Aloud. And we know from science and studying actually the brain waves and brain development of children, that if you read to children at an early age, you read to them, it makes a difference in their brain development. So that's the second program that we're going to do, is really attentive parenting and people reading to their kids. It sounds like old-fashioned, right? It is old-fashioned, but it's also with a twist. We know it makes a difference in brain science, and we know it helps kids be ready, and it gives you special time with your children, So we're going to do things like, this is our proposal. Create these little mobile libraries where you post this box with books in it. Take a book, leave a book, just to have out there for anybody to have library. We talked about things like with pizza delivery, deliver a book with the pizza. All sorts of different things we want to do for creative ideas to get people to be aware of, and to work with our libraries. Our libraries do an awesome job. They really, that Windsor Library and that Heartland Library, the people that work there, they're so creative, and they give so much of their time. They have awesome programs. So this is all about really very visibly giving the message and helping each other to kind of get back to the basics, and let's read to our kids. We're going to do kind of fun things like you'll see maybe at the pond next year, that somebody's going to pop up and do a little reading, have a little book reading at the pond, or do it at the park. So we're going to try to make it fun, work together. So that's the second program. We read aloud and play out loud. And then the third thing that we're asking for funding for is at the Resource Center, there's a room that's been underutilized. Used to have the In Your Face Guerrilla Theater in it. And we're asking for money to renovate it and make that a family fun space where we've talked to people like, do you know the artistry program in Pomfret? It's a great program for arts. and music and so on. We want to be like a branch of artistry and have them come, and we've been talking to them about doing a music together program for families. There's a dance and music therapist at HCRS that we thought we could get to do like some movement activities for families. There's a woman, Abby Tassel from WISE, who does a yoga program. And so bringing in all these kinds of things that will be for families that they can, you think, well, what does that have to do with kindergarten readiness? Well, it's building the social connections. It's helping them develop their brains in ways that are creative. And so it's working with the social and emotional competency of children and their families and providing fun connections, so keep your channels, tuned for Promise Communities, because that's something that we're presenting tomorrow. We hope to get approved, and we're going to be rolling out. And I think it'll be a great way to celebrate health in the community.
I know the library does do a great job by reading the paper, all the wonderful things that they offer to young people and the whole community. I know they do the movie night, Friday nights for free up at the Artisan Center there or whatever. So I think it's important. I don't know what how the procedure if they go out and promote library card membership for young people, because like you said, most people are more into technology, although I know they have technology at the library too. But one of my questions, I guess, is so many people that have children may be, obviously you have no experience if you've never had a child before.
Right.
And what types of programs or mechanisms are there to teach young parents the proper thing to do to be a good parent?
It's almost like you're a plant, Dave. So I didn't prep you for these questions, but
I told you we're parallel.
I know, it's true. So we've started a program at the hospital called the Family Wellness Program, and it's patterned after a program that was started by a doctor named Dr. Hujek from the University of Vermont. He came here, and it's a research-based program around the 8 health domains. And we've sent people for training around the health domains. And so we have embedded in the pediatric clinic a wellness coach and who has a history in behavioral intervention. And so that wellness coach, her name is Courtney McCaig, is a wonderful lady and very skilled. And she has already started working with families around, their questions, around trying to help them come up with solutions that are positive and bonding and can help them, with real practical things like, bedtime routines can be a little tricky, right? They can be a time of conflict and so on. So that's a lot of times things that people come in with questions about. And to this point, we've been working with families that have been referred to Courtney through the pediatricians. People that have said, I could really use somebody to talk to help deal with these things, and they've referred to Courtney. Well, this year we're going to switch the program so that it's more systematic, and it's a attraction coming soon to you, but it's going to start at 15 months. They're going to be able, the pediatricians will say, here's the family wellness program, is it something you'd be interested in? And then the next appointment at 18 months at their well child visit, it will be a dual visit. You'll have the pediatrician and you'll have Courtney. So you can sit and really talk about these wellness domains and the habits that you can start early. We talk about prevention, and that you can start early to really help be the best parent you can be. I honestly, you see the gray hair. I've worked for many years, and you know, I haven't met many, if any, parents that haven't wanted to do the best by their kids. People want to be good parents, and they do the best they can. And nobody gave us an instruction manual and a magic wand that endowed you with the skills that you need as a parent when you became one. So we all need help to do it. And so this family wellness program I'm really proud of, because I think it's a way, right? You know, part of the problem is that, you know, parents are overwhelmed. There's so much going on. Plus, people have a hard time with transportation. Plus, that, you know, so there's a lot of barriers to even get help. Some people just say, oh, you know, I'll just do the best I can. So we're trying to make it easy by, you know, you go to your doctor for the checkup, do it at the same time, you know, and we'll you know, we'll try to address, you know, work together. So that's one of the things that we're doing that I'm really proud of, because it's, you know, for the hospital, we address, again, we're talking about, we all the time are working with those people that are in the river, you know, that are sick and they need the help right then, but we also want to be down trying to prevent people from jumping in the river, you know, and in prevention. And so we think this family wellness program is one of those things that, you know, it's part of the instruction manual. It's, you know, we're looking at it as like a behavioral immunization instead of an injection. You know, you get a chance to talk about the things that matter with your kids.
You know, it's an interesting kind of approach for a hospital, and I'll mention that I'm a member of the hospital board of trustees, and I don't have a background in healthcare, so I'm learning a lot, and I think the reason I'm on the board probably is just my connection to the community. But you know, not just Mount Ascutney Hospital, but other hospitals I'm learning, you know, are shifting to, you know, you would think hospital makes its business from treating sick people, right? But increasingly, and for a long time, Windsor's been trying to keep people out of the hospital through your programs and the Prevention Partnership. And that's where the model for healthcare is shifting,
Right.
is, you know, we want to be able to have hospitals because you need them, you're always going to need them, but shift the focus around from the fee-for-service to how do we reward hospitals, health centers, providers for keeping the population healthy, and
Right.
and you know, what are the programmings that can support that? And I think
Right.
this is a classic example of the programming that's meant to do that, and how the solve finance is still being figured out.
It
But
is. I mean, we had to, again, we had to write grants to get support to do this, and you know, we'll do that. We've done that for many years and do this, but having a sustainable funding mechanism, and they're grappling that with healthcare reform, but
Yeah.
we've got to do it
right.
because it really, you know, preventing illness is the best approach. And then we have to have skilled, like you said, skilled people to
People
be able
still
to
get
provide.
sick or hurt, or,
yeah,
you know,
and
or whatever.
you know, I want to make a point because I am always sensitive to this. You know, we talked about prevention. You know, people shouldn't blame themselves if they have diabetes or if they have these
Right.
these illnesses. You know, people do the best they can, and and there's genetics involved in different things, and so it's not like it's a blame thing. It's an opportunity thing for people to try to prevent what we can prevent and do the best to help ourselves, you know, be healthy as a community.
It's, you know, to some extent, focus on those things that you have some control over. And, you know, in genetics you don't, but if there are little things you can do to maybe improve diet or
Right.
get a little bit more exercise,
Right.
or cut down on smoking with a
Right.
goal to maybe eliminating at some
Right.
point,
Right.
those are good steps to take.
Right. And we have, we're a member of the Blueprint for Health, and through that program, we have workshops. We have tobacco cessation workshops. You know, we're going to be providing them. We have them every week. We have chronic pain workshops. We have healthier living workshops. We have the RAP workshops. I don't know if you've heard about them, but these are all, we get support through the Blueprint for Health. And these workshops are free to the public. You know, just call the hospital and you can get, and you know, we want you to come because we want you to be healthy, and we feel like people are powerful in themselves, and just joining together, it's a peer-led workshop, using its best practice approach, strong, solid principles, and talking about it and making a plan for yourself that works for you. When you're in with a doctor, they do a great job, and they only have this amount of time, to do it. But you're at home this amount of time. And so these workshops, when you go for a series of times, you get to spend time on yourself developing your own plan. And so that's another thing that we offer, that we've gotten funding for. There shouldn't be any barriers. There shouldn't be any stigma. Everybody needs help, from the youngest to the oldest, from the richest to the poorest. Everybody needs help.
Well, you talk about the funding and stigmas, and I am involved in debates all the time about the whole world's been pretty crazy lately, and financially is part of it,
Yeah.
and I have friends and family who I argue with all the time that say things like, why should I pay for that? They've made poor choices, and I think you've hit it really well, that we all have different backgrounds, we all have different experiences in life, and it would be nice if we were all dealt the same card.
Right.
But I think that society needs to understand that some of this isn't, you're doing the best you can to educate and control things, but some things are beyond anybody's, even when you've done the best you can.
Oh, that's right. That's exactly right. And so then we walk the journey together. It's a privilege for us at the hospital to take care of people when they're ill, and then we walk the journey together. Yeah.
I think that there are also some, if you kind of, I understand why people say that, and there's some self-interested, what's it mean for me? And it may not be obvious, but it might mean, if we have a healthier population, that your insurance premiums go down, or that the costs that the healthcare providers are charging go
Right.
down, because and things like that, or that absenteeism from work or school
Right.
has an impact on the economy. So these are not things that sit right in front of you, but they do have an impact on me and you and the rest of us.
Well, I agree, and like I said, I met Jill, 15 years ago now, probably more, and she was out doing, for what's best for the community back then, and one of my things I wrote down I wanted to say is, God bless you. I don't know how, because you might not admit it, but I've been to the meetings where you haven't always got everything you
Oh,
wanted,
yeah.
and I mean, and it's lots of times it's financial
Yeah.
too, and
Yeah.
and you're still doing it, and for the best of everybody. And I want the community to know that one of the things that she fought very hard for, that was not easy at all, was the skate park here in Windsor, and that was it wasn't really a good idea for a lot of people, and it's still one of the most well-utilized things in the community right now. So a lot of people, those are the type of things over and above being a nurse that she's out there doing, so for the good of everybody.
Well, Dave, we do it together, right? I mean, Dave, you were part of that effort too, and so you can't get away with that
No,
because.
That's
yeah.
why
Yeah.
everybody's got to do
Yeah.
a little,
Yeah.
Jill, what would you tell, I think one of the reasons we ended up doing this show is because we felt that it would be good to have people like yourself have a conversation and get information out to people in a way that was comfortable for them to access it, and if they don't like it, they can change the channel.
Right.
But whether it's a local historian or somebody that's involved with community health or a politician, what's nice about Windsor On Air is they can kind of access it from the comfort of their home.
Right.
And so when it comes to these programmings, we've been to meetings and stuff, and this is oftentimes the same handful of people that show up, and we're civically minded and so forth. But how do you get more people in? And the same with your workshops, what would you tell people that maybe are not comfortable reaching out, calling the hospital? How do, what kinds of words of encouragement in terms of how they can access some of these services or make some of these steps on their own in a way that's comfortable to them?
Right. So, I mean, obviously, I am open, and I can,
You're very
my phone
approachable,
number.
right.
Yeah. My phone number is 674-7224. They can call. People can call if they have a question. They can call the hospital. The number is 674-6711, and ask for also Samantha Abrahamson. Samantha is the coordinator for our workshops, and she's probably one of the nicest people you want to meet, and easy to talk to. And I think just know that we care, and we together can make a difference, and and call. And when you feel like we try to advertise, we try to get the word out, and just know that actually try it. Just give a little risk to try it once. And if you don't want to come back after one time, that's okay. That's your choice. But if you're smoking and you think, oh, I wanted to do it, and you see about the tobacco cessation program, come. You'll meet Samantha. You'll meet some other nice people. And it might help you. And so try a risk a little bit. If you're dealing with depression, or you get anxious and you see the RAP program being advertised, give it a chance. I'll tell you what. It makes a difference.
What does RAP stand for?
Stands for Wellness Recovery Action Plan, and it helps people look at what works for them, to have a plan to address when they feel healthy, how to stay healthy, plans to when they feel like they're getting into trouble with anxiety or depression, who's going to help them. Do they have a plan of what works for them? It's a great program. It's a really great program. The other program, people in our community, the chronic pain workshop. You would think, oh, how awful to go to a chronic pain workshop. Honestly, they're like a band that works together to really help themselves address with what are the things that help with chronic pain that aren't medication oriented. Things that they can do that can help, make their lives easier and better. So I guess I would say, know that you're welcome, know that we care, take a risk, and come and join us. And if you see these things advertised, come on down. And if you don't have to stay. If it doesn't help, maybe it will.
Or if you have a friend that you think might need this, let them know.
Right, exactly.
Right.
And maybe come with them.
Yeah, and go
because
with
sometimes a friend needs a friend.
Yeah.
To make it through. So we encourage the buddy system. Also, sometimes you hear something and your buddy doesn't, and your buddy hears something and you don't. Together, you put a complete picture together. So it helps to have a buddy come along. Yeah.
Well, sometimes we're all pretty busy doing a lot of things, and try to pay attention and look at what's going on and what's happening, because I know sometimes we're so stressed out by other things we miss things that could help.
Right.
I think we got about maybe 4 or 5 minutes. You mentioned the resource center. It's the building that we're sitting in, and I know the hospital has been very involved with that. Can you maybe talk a little bit about that and what's offered here?
Right, I'd be happy to, because this is a gem, I believe, a gem in Windsor. I believe it's a place, how many years? It was in 2002 that the Resource Center opened. Before that, we recognized that Windsor has always been, kind of a gap community. There's all of the social services in Springfield and in Hartford, and people had to go to be able to either access some of these programs and services, or they wouldn't get them. So the idea was to bring people together at the resource center so we could offer locally some supports. And it's, we have, Windsor on Air is here, and that's a great resource, a gem for our community. And then there's Vermont Adult Learning offers classes so adults can get their GED. And we've got multiple educational programs. HCRS, and we have private counselors that come here. Economic services comes here. The Springfield Supported Housing is coming up here, and they're here on Thursday. People that are struggling with homelessness and need help in that way. Economic services and southeastern Vermont Community Action is here. So, when people need help with fuel assistance, people need help with their rent or utilities, they can access that. And actually, SEVCA, Southeastern Vermont Community Action, has great programs on financial literacy, helping people with their budgets. So they help not only with some services and getting you through the gap, but they also help you try, long term, make a difference. And all of the social services and groups together, we get together on a monthly basis so we can share information so that we try to maximize the resources that are here. And, so the Windsor Connection Resource Center really tries to live its name. And we're hoping with this Promise Communities and the family space, it will even help it more. We also have the Giving Room where, people give freely, give their clothes, gently used clothes, and people can get them. Prepare for a job interview and have a new set of clothes. There's generosity. I think if the one thing I would say, not the one thing because I say a lot about Windsor, but one of the things I say about Windsor is Windsor cares. There's amazing generosity within this town and the people of this town. And people really work together. That is what I found. And it makes it, a great place to make a difference.
Any concluding comments, Dave?
No, I just want to thank Jill for coming in. I think it's been very informative and enjoyable, and I'll keep bothering her when I see her out on the street.
Yeah, well, thank you as well. And this is just the tip of the iceberg about kind of what Jill's involved with and the information she has. So we thank you for coming on the show, and we'd love to have you back again.
Thank you. It's a pleasure.
Thanks.
Yeah, thanks.